Hypoglycemia, the topic of discussion in this video. The content of this video are meaning of hypoglycemia, signs and symptoms of hypoglycemia, identification of hypoglycemia, treatment and patient and family teaching up for hypoglycemia. At the end of this video, the students will be able to discuss the definition of hypoglycemia, list the signs and symptoms of hypoglycemia, discuss the treatment of hypoglycemia, and explain the importance of educating patients and family members about hypoglycemia. Let us see the meaning of hypoglycemia. Hypoglycemia means low sugar in the blood. That is, hypo means low and glycemia means sugar. So, low blood sugar is known as the hypoglycemia. And this hypoglycemia occurs when the blood glucose falls to less than 70 milligram per deciliter. In severe hypoglycemia, the blood glucose levels will be lesser than 40 milligram per deciliter. Let us look into some of the causes of hypoglycemia. That is too much insulin. When the patient takes excessive insulin above the recommended dosage, that can suddenly lower the blood glucose level, causing hypoglycemia. Too much oral hypoglycemic agents. Similarly, when the patient takes anti-diabetic medication, when they take too much of medications or excessive dosage also can cause the hypoglycemia. Or when the patient takes very little amount of food than required, and when they perform excessive physical activity also can drop their blood glucose levels, leading into hypoglycemia. Let us look into the occurrence of hypoglycemia. Hypoglycemia may occur at any time of the day, either day or night. It often occurs before meals, especially if meals are delayed or snacks are omitted. We can classify this hypoglycemia based on the day, that is the timing of occurrence. That is, mid-morning hypoglycemia usually occurs when the morning insulin is peaking. Late afternoon hypoglycemia occurs during the peak of the morning NPH insulin, when that insulin dosage, when it reaches the highest level in the blood, it can suddenly drop the blood glucose values. Middle of the night hypoglycemia, which is usually associated with NPH insulin, which can occur either in the evening or the pre-dinner time. Let us look into the clinical manifestations of hypoglycemia. Generally, these hypoglycic symptoms are learned with the mnemonic called he is tired, H for headache, S for sweating, T for tachycardia, I for irritable or restlessness, excessive hunger and dizziness. So the mnemonic which will help us to remember the signs and symptoms of hypoglycemia is he is tired. Let us see the manifestations of moderate hypoglycemia. In case of moderate hypoglycemia, there will be a blood glucose level which will be lesser than 70 milligram per deciliter, and this creates the need for glucose in the brains will be more. So here the person also will manifest with the signs and symptoms of central nervous system, where the person will have inability to concentrate, headache, lightheadedness, confusion, memory lapses, impaired coordination, double vision, drowsiness, emotional changes, irrational or combative behavior, numbness of the lips and tongue, and slurred speech. In case of severe hypoglycemia, here again the person will manifest with the central nervous system signs and symptoms. The patient may have disoriented behavior, seizure, difficulty arising from sleep, and loss of consciousness. Here the person needs the assistance of another person for treatment of hypoglycemia. Next, we will see how to identify and diagnose the hypoglycemia. Symptoms of hypoglycemia may occur suddenly and vary considerably from person to person. We cannot expect everybody to have the same symptoms of hypoglycemia. Usually we make the assessment through checking the blood sugar levels and patient symptoms. Affected patients must perform self-monitoring blood glucose on a frequent, regular basis, especially before driving or engaging in other potentially dangerous activities. We can teach the patient to monitor their own blood glucose level if we feel that the person is very prone to develop the hypoglycemia. Coming to the management of hypoglycemia, the best management is treating the patient with carbohydrate is the immediate treatment. The usual recommendation is for 15 gram of a fast-acting concentrated source of glucose. Usually we call it as the 15-15 rule. That means ask the patient to have 15 grams of carbohydrate to raise their blood glucose and check the blood glucose after 15 minutes. If it is still below 70 milligram per deciliter, we can ask the person to have another serving. That is, they can have glucose tablets or simple glucose like sugar or juices, honey or corn syrup, or they can have some candies, something carbohydrate food, they can have it. If the person is having the fruit juices, no need to add the sugar because the juice is already sweetened. Suppose if the patient is unconscious, who cannot swallow, then 1 milligram of glucagon can be given either subcutaneously or intramuscularly. A concentrated source of carbohydrate followed by a snack should be given to the patient on awakening to prevent recurrence of hypoglycemia. Suppose if the patient has nausea, they can be asked to lie down in the side-lying position to prevent aspiration in case they vomit. Next, we'll see the prevention of hypoglycemia. Hypoglycemia is usually prevented by having a consistent pattern of eating behavior, that is between meal and bedtime snacks sometimes may be required for some people, and having an insulin administered in correct dose and at correct time. Physical activity and exercising should be kept at the moderate level and according to the tolerance of the patient. Routine blood glucose test should be done. Advise the patient to avoid alcohol drinks with anti-hyperglycemic medication. That is, when they take the diabetic medication, they are not supposed to drink alcohol. Explain to the patient the different drug interactions with anti-hyperglycemic medication. Some drugs may interfere with the diabetic medications like allopurinol, aspirin, probenecid, or warfarin. So if patient is taking these medications for some other disorders, we have to ask the patient not to take these medications along with the diabetic medication. Next, we need to familiarize the patient and their relatives with the common signs and symptoms of hypoglycemia. Next, we'll see the patient education. So, all patients who is treated with insulin should wear an identification bracelet or tag stating that they have diabetes. Patients, family members and co-workers must be instructed to recognize the symptoms of hypoglycemia. It is important that patients with diabetes, especially those receiving insulin, can learn to carry some form of simple sugar with them all the time. People with diabetes, particularly those who use insulin, should have a medical ID with them all the time. This is about hypoglycemia and its management. To conclude this video, throughout the day, depending on multiple factors, blood glucose levels will vary up and down. This is normal. If it varies within a certain range, patient may not able to tell. But if it goes below the healthy range and is not treated, it can get dangerous. These are some of the references made. Thank you.